Having a child is a dream for a lot of people, but that dream doesn't come true for everyone.
That's true. According to the National Institutes of Health, roughly 9% of men and 11% of women of reproductive age in the U.S. experience fertility problems. If a couple turns to in vitro fertilization, it can cost $20,000.
On top of that, Maine and Vermont are the only New England states that don't require private insurance companies to cover those costs. But there's another option that no one really seems to want to talk about. News Center Maine's Rosalind Flaherty joins us now with one couple ready to talk. Roz?
Chris and Amanda, the option is a surrogate, hiring another woman to carry your baby. Caitlin and Sam Burrell in Poland, Maine are talking about it and hoping their words will help other families like them. Sam and Caitlin Burrell have always wanted to be parents.
I have the best dad in the world. I have the best father-in-law in the world, and I have so many friends that have kids and they love it.
It's really the only gift I wanted.
In the fall of 2019, this couple's dream became a reality. They were pregnant. But the dream took a painful turn when they miscarried. And in the middle of mourning the loss of their baby, the news got even darker.
I was going for a couple follow-ups, and I ended up finding a lump in my breast.
At only 29 years old, Caitlin was diagnosed with stage 2 breast cancer. Their world, which was already turned upside down by the miscarriage, was now turned inside out by cancer.
We went from family planning immediately to survival mode.
It was definitely scary, and I think at first we didn't really think about the future. You're thinking about fighting in that moment of, well, let's, fight this, let's get through it, let's, conquer cancer and move on with our life.
Before her cancer treatments, they decided to freeze embryos. It cost them $12,000, all of it
Sick to our stomach.
out of pocket.
You don't want to start a family and put yourself and your new baby in a poor financial situation.
According to Resolve New England, a nonprofit dedicated to providing support and education for those suffering with infertility, Maine and Vermont are the only New England states that don't have a law requiring private insurance companies to cover in vitro fertilization costs. A bill before the Maine legislature would change that.
If this bill becomes law in Maine, people of reproductive age that get cancer or other illnesses or treatments that might impair their fertility, they would have insurance coverage for the actual fertility preservation procedures. So if they were doing IVF to create embryos for them to use after their cancer treatment is over, or at a better time for them to be able to use them, then that would be covered by insurance.
After freezing their embryos, Caitlin underwent a double mastectomy and 12 grueling weeks of chemotherapy. But no matter what, she and Sam were not going to give up on their dream. They decided to find a surrogate to carry their child.
We both feel like what we've been through this last year, we never want to do again. And if there is a way for us to be able to keep me as healthy as possible.
Caitlin took a different approach to finding one. She went public and posted their story on social media.
We had so much support, so many people reaching out to us, but it's a process.
Caitlin says it will cost them roughly $50,000 to have their child by surrogate.
When it comes to insurance and stuff like that, for people to tell you that it's not covered because it's an elective, it's a choice. That's like saying that my double mastectomy was a choice.
Resolve New England says if the bill passes, it would also potentially cover the medical aspects of the process.
The parts of the procedure that actually will be done with the gestational carrier potentially would also be covered by insurance. So things like legal fees or agency fees, those would be the individual or couple's responsibility.
Caitlin and Sam are trying to figure out how they will cover the costs and wish surrogacy was talked about more.
We jokingly say, like, Kim Kardashian was the only one that we knew that had used a surrogate.
Maybe not talked about as much as that surrogacy, but talked about and made more affordable for other couples.
Everyone's entitled to having a family, and it doesn't matter how the family is created or what type of assistance is needed. We didn't we didn't do anything to put ourselves in the situation, and we want to be parents more than anything.
While we were in the editing process of telling this story, Caitlin and I talked, and she said a woman from Ohio messaged her on Facebook volunteering to be their surrogate. They will now begin the time-consuming and expensive legal and financial process. If you're thinking about surrogacy, Resolve New England encourages all parties involved to have legal counsel for the protection of everyone involved. The Burrells have created a GoFundMe page to help out with the costs. You can find it on our website and mobile app. Rosalind Flaherty, News Center, Maine. Amanda and Chris.
Roz, thank you.